Good evening, viewers. Welcome to our channel, Ahara Arogya Adhyatma. So, we have with us a big luminary in pediatric cardiology, Vijay Lakshmi Madam, with us to talk about congenital heart disease awareness. Today happens to be the 14th February, which is also a Valentine's Day. It is very well known as Congenital Heart Disease Awareness Day. So, to talk about myself, my name is Dr. Srinivas. I'm a pediatric cardiologist by profession. I work in Thane, so in a hospital called Skims Hospital. I've been in Mumbai for last 14 years, and we have with us Madam Vijay Lakshmi Madam, so who is a very big luminary in our country and also internationally very popular. She was former HOD of Pediatric Cardiology of Sri Jayadeva Institute of Cardiovascular Sciences, Bangalore. Madam has been adorned with plenty of awards. She is has a distinction of first lady cardiologist of Karnataka and first person to start pediatric cardiology department in Karnataka. Madam was professor and HOD of pediatric cardiology for several years in Jayadeva Institute of Cardiovascular Sciences, and she has nurtured many young doctors and inspired us to become pediatric cardiologists. Madam has bagged an amazing 40 gold medals and 3 silver medals during her career. She has done pioneering work in acute rheumatic fever. She has written several books. So we have grown up reading all these books as young doctors. Madam has delivered 32 prestigious orations. So we have with us Vijay Lakshmi Madam. She also has received awards with luminaries like Abdul Kalam ji sir, former President Pratibha Patil Madam, 4 chief ministers. She has won Best Paper Award 7 times in several national and international conferences. She also has been past president of Indian Academy of Echocardiography. Madam, we are very lucky to have you with us today. Welcome, Madam. Today the role is reversed. I will be asking questions to Madam and Madam will be answering.
Thank you very
So,
much, Srinivas. It's a
thank
pleasure.
you, Madam. Pleasure, Madam.
Always,
Madam,
as an examiner, I used to ask
yeah,
questions. Now you are my
yes, Madam.
examiner and I'm your student.
Thank you, Madam. Thank you, Madam. Madam, let's begin with answering. What are the symptoms of heart disease in children and how is it different from adults, Madam?
Yeah.
Is it the same? This is for awareness of the parents.
Yes. See, in the adult, usually it is a coronary artery disease. They come with the heart attack, with the chest pain and the sweating and the vomiting. Whereas in children, a chest pain is not predominant, but they have breathlessness and then suck cycle. That is, they are not able to drink milk. And when they're drinking milk, they get tired and they just sleep off. And then again, they wake up and they start drinking, and that is, the drinking mother's milk, suckling itself is an exercise. So like exercise test is positive in this, and they have the breathlessness, and the chest retraction will be there. Lower chest retraction will be very obvious, and the chest protrusion may occur as it grows. And apart from that, they have repeated respiratory infection. According to the Indian Academy of Pediatrics, more than 2 times, if the child is admitted for the lower respiratory infection, that has to be taken as underlying heart disease, and they have to investigate and do the echocardiography for that. So if there are any increased pulsations on the chest, and anybody can make out, the parents and even the daddy who comes and gives a bath, she had detected once. So that way it is very important. And apart from that, if the baby is blue and its milestones are delayed and the child is not growing as much as others, and if the child has got the mongoloid features like the Down syndrome, and those are all also very important. Sometimes they have 6 fingers, or they have the syndactyly, that is the fingers are joined. So like that, there are external defects also, and these children can have the other defects like the kidney or the single kidney, or all those other things will be there. And that's why, we should not be happy in detecting just one, because the like birds of the same feather flock together. These congenital defects are there in multiple, so we have to see the child as a whole.
Thank you, Madam. So many things to look for in babies. Madam,
Yes.
where should the parents start from? Whom should they go? Who is a doctor they need to consult? I mean, we know that nowadays even these heart defects can be diagnosed even antenatally before the baby is born
Yes.
also. So who
Yes.
should be the first person of contact for the parents, madam?
Yes. So if they have already done the fetal echocardiography and the diagnosis is there, and it is a multi-speciality teamwork. So they have to go to, deliver in a place where they have the immediate attention of the neonatologist and then transferring for the surgery if it is a complex one. And if it is a simple one, they can deliver anywhere and then a pediatrician can attend and then refer the patient to the pediatric cardiologist. But many a times in our country, it goes undetected. And suddenly, when the child is going to the school, it drops dead and then it becomes a sensation. If you have to avoid that, every child after the birth, if they undergo a echocardiography, it is very, very important to rule out the conditions. And that's how, especially if there is a pinpoint aortic stenosis. I had one of the patient, the first baby had died and then the mother underwent lower cesarean section, and then the child did not cry and the child was put on ventilator, and just 14-hour baby, and it was on ventilator shifted to Jaydeva. And then I did the balloon dilatation with the 4 millimeter coronary artery, and the child became all right. Otherwise, it would have been 100% death. So this is how we know if it is a very emergency, it has to be attended immediately. Otherwise, we wait till the child is going to the school going age and then treat. So here, it is like a teamwork, and all of us together, we have to work to save the baby, because every baby is very precious and we love the children and we have to do our best to the child.
Thank you, madam. Madam, we have talked about so many lesions now. Parents probably want to know if a heart disease is diagnosed, does every child require surgery?
No.
Or many of them can just be followed?
Yes. See, there are three things. One, if the holes are very small, the pure blood is on the left side, impure blood is on the left side, right side. And the partition is there, and we call it as the intraatrial or interventricular septum. If the hole is there, just 2 millimeter, 3 millimeter, 4 millimeter atrial septal defect, we don't do anything, because as the child grows, it will close off. If there is a ventricular septal defect or the patent ductus arteriosus, we close it with a device. They don't go for the surgery. But if there is a transposition, the great arteries are transposed or the ventricles are transposed, or there is a complex where the valve is not there, since complex ones, they go for the stage surgeries or the immediate surgery. And especially transposition, within 7 days, the child has to go for the arterial switch. So these are all decided by the pediatric cardiologist like you. And then, depending on that, tailor-made treatment is given to that child. It is not that the same treatment is given to everyone. So if there is a block in the aorta, we open with the balloon. If there is a valve is closed in the like pulmonary stenosis or aortic stenosis, we open with the balloon. If the holes are there, we close with the device. And only the complex congenital, the blue babies, they go for the surgery. And that is the open heart surgery. Yes.
Madam, parents' common question and worry is that such small baby, will the baby survive surgery? Will the baby have capacity to do surgery? As you said, you have done this procedure on day 1 of life also. How are the general results of heart surgery? Should the parents be really worried, or how are the results?
Dr. Srinivas, the 30 years back, it was a different cup of tea at that time. People used to worry and they used to say, let the baby become 6 kgs, 7 kgs, 9 kgs, but now no more. And I have seen in the Mayo Clinic, just a newborn 3-day-old baby, tetralogy, Dr. Puga was closing it, such a tiny one, And today the things have advanced, and in India, we have a world-class center and all the things are done at the best, but provided they are diagnosed in time and they go in time before it is too late, because stitching time saves life, and that has to be remembered by the parents. And otherwise, after spending lakhs of rupees, if the baby dies, they feel very bad. But they must realize that in the antenatal, that is when the lady is pregnant, that time only she has to remember. Now we have gone further. That means even before they conceive, the parents have to go for the genetic counseling also, and also the parent counseling. And then the things like folic acid and the zinc, and these the drugs are given to prevent the congenital defects like the neurological and other defects also. And apart from that, in the first 3 months, we do the fetal echocardiography. We will discuss in detail about that.
Yes.
And then,
Yes, ma'am.
that is the time we decide whether this child requires termination of pregnancy or continuation of the pregnancy. And if it is complex and if it is continued, everything is described to the parents, and the parents, the choice is given to them. And then depending on that, it's a teamwork. We all work together.
Thank you, madam. Madam, again a common question. How expensive is this treatment? Can every Indian in today's era afford a heart surgery? Are there avenues where they can go for unaffordable people for heart surgeries?
In fact, all the children need not go. If I have done my own study, when I compared with the West, more than 3,600 congenital heart disease consecutively catheterized, almost 65% of the patients can be completely cured with the non-surgical treatment. And the
Okay.
remaining patient, they go for the surgical treatment,
Surgery.
that is the open heart surgery. And there also, it is not impossible. Even the most complex, except the hypoplastic left heart, we can treat almost all of them. And that is the reason now there is a new lease of hope for the parents as well as the child. So earlier the child used to die, and so that is the fate of the baby.
Yeah.
It has died, but today it is not. The doctors can literally save the dying baby provided they come. And the money also they need not worry, because
Yes.
earlier they used to have difficulty. I myself used to struggle, and from Sadhu Vaswani Trust and other people used to come and donate the money, and I used to do to the poor patients in spite of being subsidized in the government hospital. But now the Arogya Bharati is there, up to 5 lakhs it is given by the central government
Government.
itself. So money is not a criteria.
Not a problem.
Only
I
the
agree, madam.
only thing that the awareness in the parents, they should come to the doctors in time, and before they become pregnant, after they become pregnant, and their responsibility also they must realize. Because if the parents drink and the smoke, and the mother takes unwanted drugs, and then the baby will unnecessarily suffer. So the parents also should know their responsibility. It is
Yes.
not that the only doctors have to struggle. They have to take care of the baby and get everything done, so that we have a very beautiful baby. Because having a baby and bringing up is a pleasure to the parents, and that should not become a pain, and that can be avoided today. And then we are there to help them, and that's how they must consult in time and see that their baby is born as normal baby. If it is not normal, we make it normal.
Correct, madam. Thank you very much, madam. So, two important messages is early diagnosis and detection will result in excellent outcomes, whether
Yes.
surgical or non-surgical. And many of simple lesions like ASD, VSD, PDS and all require only one single time procedure, and the baby will have lifetime cure. The baby
And
will grow up
not
like,
only that, the device closure, the beauty is
yes,
just 2 millimeter nick is done in the groin, and
yeah,
that closes, and even if the child grows up and wears a bikini, nobody can make out. And that
yes,
is the
yes,
beauty of the intervention. So today, the things have advanced.
correct. So parents should not worry about diagnosis of heart disease. Only thing is timely diagnosis is very important.
Yes.
Madam, thank you very much. In short duration of time, you are given so much of knowledge and information to the parents. We are always indebted to you, madam. Thank you very much, madam. Thank you.
Thank you so much, Dr. Srinivas. It's a pleasure to be talking to you. Thank you.
Thank you.